afternoon. I'm Z. Scott, president at Chicago State University. I am so delighted to welcome you to this afternoon's important panel discussion. I first want to thank our co-hosts for today's event, the Bronzeville Children's Museum and the Chicago Urban League for their partnership and invaluable service to our community. Finally, I also want to thank and welcome all of our attendees who are joining us virtually. Equity is at the heart of what Chicago State University does every day, which is why the university and its foundation are committed to making sure our community has access to factual information about the COVID-19 vaccine, as well as access to the vaccine itself. Chicago State University is so proud to be partnering with the City of Chicago and other healthcare organizations to offer vaccination pop-up clinics on campus for our students, faculty, staff, and community. As our country continues to grapple with COVID-19, it is now more critical than ever that every Chicago resident have access to COVID-19 vaccinations and vaccination resources. It is now my privilege to welcome this afternoon's conversation moderator, Dr. Kareem Watson, Chief Engagement Officer of the National Institutes of Health. Dr. Watson is the new Chief Engagement Officer for the All of Us Research Program at the National Institutes of Health. He comes to All of Us from his role as Associate Executive Director of the Miles Square Health Center, a group of federally qualified health centers in Chicago affiliated with the University of Illinois Hospital and Health Sciences System. He has also served as the Associate Director of Community Outreach and Engagement for the U of I Cancer Center as Assistant Research Professor in the University of Illinois Chicago School of Public Health. His contributions, and there are many, have earned him recognition by the Chicago Urban League, the American Health Association, Longevity Foundation, and many others. Please join us in welcoming our moderator for today's conversation, Dr. Kareem Watson.
Thank you, President Scott, for that generous and gracious welcome. And thank you to the organizers and the event planning team today. We're excited to be here today to have a conversation with you about the importance of the Vaccinated campaign and the work that the Chicago State Foundation, the Chicago Urban League, as well as the Bronzeville Children's Museum have taken on to address vaccine hesitancy, facts over fear. Prior to us getting started today to do a deep dive into the conversation about the importance of the COVID-19 vaccine in underserved populations, I'd first like to walk you through a little bit about my role at the NIH All of Us Research Program. So thank you so much for pulling this up. And I've been in this position for a little over 5 weeks now, and I'm excited to note that as the Chief Engagement Officer of the NIH All of Us Research Program, the All of Us Research Program is setting out to be one of the largest and most diverse cohorts of research participants, where we are creating a platform where we are gathering health information for up to 1 million Americans that truly represent the rich diversity of our country. Next slide. The All of Us Research Program is historic and actually grew out of the initiative on the Precision Medicine Initiative, in large part even by efforts supported by former President Barack Obama, and his initiative to ensure that medical breakthroughs really were achieved in a timely manner, but also that those breakthroughs were not just going to impact the health of some of us, but that those medical breakthroughs would impact the health of all of us. And as Dr. Francis Collins, the director of the NIH, says, All of Us is among the most ambitious research efforts that our team at the NIH has undertaken. Next slide. So the kind of questions that this resource may help, and the reason why it's important for this audience and others today to learn about the importance of All of Us, is that we're going to be asking some critical questions about the All of Us. The data that we're collecting is going to allow us to think about prevention earlier, treatment earlier, but as well as making sure that a lot of the trial and effort that goes on right now, whether it's chemotherapy, treatments for cancer, whether it's treatment for pain disorders, and even for us to think about ways we can think about different types of pain treatments that may not be as addictive as some of the current therapies that we have. Also thinking about how can we slow the progression of dementia in our communities, thinking about how can we increase the knowledge that we have about the treatment of diabetes and other preventable diseases. But more importantly, this database will also allow us to provide researchers that reflect the rich diversity of the U.S. an opportunity to ask questions that not only include the biology of what someone is born with, but also their lived experience, social determinants of health, as well as environmental data. Next slide. Already, we've seen the impact of the All of Us research study on the COVID-19 pandemic. And it was actually evidence that was provided through the All of Us rich data set that suggested that all of the COVID-19 virus was actually present in the US by Christmas of 2019. That's actually data that came from the All of Us research study. And there's also studies that's showing that we've done studies in the All of Us program that's also looking at not only the biological impact of the COVID-19 pandemic on communities, but also the social and psychosocial and emotional impact as well. And we're excited about the information that we'll be able to continue to ask about the coronavirus and even the impact of those that have been impacted by COVID-19 and the impact of living with the condition. Next slide. So I want to thank you all for giving me this platform today before we jump into our deep discussion, to talk to you about the importance of the NIH's effort for All of Us. And if you want to learn more about how you can get more information about All of Us, please visit joinallofus.org, researchallofus.org, or go to the allofus.nih.gov. So now we are going to get into the heart of the matter. And it's my distinct pleasure to introduce to you today our panelists and to talk to you about the purpose of our program today. So in partnership with the Chicago Urban League and the Bronzeville Children's Museum, Chicago State Foundation has launched a Vaccinated campaign designed to motivate and incentivize more African-American Chicagoans to become vaccinated. And you'll hear more about the opportunity to get vaccinated at the end of this event, but I also want to highlight something now. On tomorrow, go back to that slide, please. On tomorrow, Saturday, October 16th, from 1 p.m. to 3 p.m., you'll be able to get more information about an event sponsored in collaboration with Blue Cross and Blue Shield of Illinois. Well, they'll offer COVID-19 vaccines and the flu shot, free lunch, and at Ancient Sweet Cafe, Growing Mobile Bus will also be available for pop-up plant and flower sales. So more about this vaccine event that's going to take place. So again, pay close attention to that address, 9301 South Stony Island. All are welcome, and we'll also remind you of this event at the end of today's program. So now I want to introduce you to our esteemed panelists. I have the privilege today of talking to you about introducing you to some panelists that are actually friends and colleagues of mine, but also introducing you to some of what I think are going to be some of the budding stars that you'll be hearing more about in the public health space. So if we want to pull up the information about our panelists. So while we're waiting for that information about our panelists, I do just want to remind you all that you will have the opportunity to engage in questions and answers. The panelists that we're going to introduce will have a lot of information, a lot of expertise. So please make sure you put your questions in the chat, and we'll make sure that we get those questions answered. So our first panelist that we're going to introduce is going to be Kimberly Mccarter. Kimberly Mccarter is a PharmD candidate at Chicago State University and is really representing that student voice for us. She's a fourth-year pharmacy student at Chicago State College of Pharmacy with a certified pharmacy technician career that includes over 15 years of experience with extensive experience in working with underserved populations and those with chronic conditions. Next, we also have Brianna Hudson, excuse me. Brianna Hudson is a PharmD Chicago State University, a fourth-year student and pharmacist who's demonstrated history of working in the hospital and healthcare industry settings. Brianna is pursuing a doctorate of pharmacy, PharmD from Chicago State University College of Pharmacy. Really happy to have Brianna here with us today. And someone I actually called a national hero, Dr. Damon Arnold, the medical director of Blue Cross Blue Shield of Illinois. And Dr. Arnold brings to us decades and years of experience, both from his military service as well as his public health service, and the work that he's now currently doing with Blue Cross Blue Shield of Illinois, and truly is a national expert that we are lucky to have right here locally in the Chicagoland area. And last but not least, I want to introduce a friend, colleague, and someone I consider a mentor, and in many areas, one of the experts in so many areas of public health, Dr. Suzette McKinney, who is the current principal and director of life sciences at Sterling Bay. Each of our panelists today are here to provide their experience and their expertise in some topics related to what are some of the things that we're seeing around vaccine hesitancy and uptake in underserved communities, as well as the African American and Latinx community. So I want to welcome all of our esteemed panelists and thank you all so much for being here today.
Thank you for having me. Can you hear me okay?
You are perfect, Dr. McKinney. Thank you so much.
Awesome.
And Dr. Arnold, are we good with you? Just a little bit of sound check, Dr. Arnold, but that's okay. We know that you are an expert at this and you will be on soon. What about Brianna and Kimberly? You all okay? We got sound with you?
Yes. Hello,
Hey, everybody.
Good afternoon. Thank you all so much. Dr. Arnold?
Yes.
There you go.
Can you hear me now? Okay, thank
We
you.
sure
Thank
can.
you
Welcome
for
and
having me.
thank you all.
I have two computers going at the same time.
It's our new normal. This is our new normal. Dr. McKinney has a background that looks virtual, but I think it's actually real.
Yeah.
I'm at the airport.
And,
Of course
I
you
see.
are.
She probably has 4 computers going. She's always busy.
So we're just gonna jump right in. So I'm gonna read to you all some statistics that I found looking at where we stand with the current state of vaccination and open us right in about the dialogue that we're hearing in African American and Latinx communities related to vaccine hesitancy. And I actually like to use the term sometimes justified medical mistrust, because I don't like to just say that the mistrust that we're seeing in our communities is actually not justified or not built on what we've seen as some historical injustices that have been done to some communities. But in the US, there are 188 million people that have been vaccinated as of data from as of early as yesterday. And in Illinois, we're right at about 6.89 million people vaccinated, which about 54.3% of the population. And in Chicago, we're right at about 1.7 million people vaccinated, with about 63.8% of the population. But if you break that down by race and ethnicity, what we see is that in Chicagoland, 32.9% of whites are vaccinated, 29.8% of blacks, 29% of Latinx, and 6.7% of Asian American and Pacific Islanders are vaccinated, according to data from the Chicago Department of Public Health. And I want to encourage all of our listeners to always ground yourself with data and to go to these publicly available sites like the Chicago Department of Public Health and the Illinois Department of Public Health to get the most up-to-date information. So a lot of the current dialogue that we're hearing from Black and Latinx communities related to vaccine uptake is rooted in historical and in many cases justified medical mistrust and justified lack of trust of the government public health-led efforts. How do we balance a healthy level of curiosity, a healthy level of being critical of our public health efforts with arming ourselves with knowledge and facts? So, Dr. McKinney, I'm going to start off with you. You know, with your background in emergency preparedness, I know firsthand that you have to arm yourself with public health facts and then make sure that those facts get out to our community. What is the one way you've encouraged community members to arm themselves with the facts?
Thank you so much for the question, Dr. Watson. I think, first and foremost, as public health officials, we have to also arm ourselves with the facts, and we have to ensure that we are being careful when we go out into these communities and make sure that information that we are sharing with community members is backed by data, rooted in science, and is also factual. However, I think we also have to do everything that we can to ensure that we are empathetic to many of these communities. Community members don't like people coming into their communities telling them what to do. So personally, I root myself in the community. I always give my background when I'm talking to community members, and I try to help them understand, first and foremost, that I was raised by the very same community that I am actually in at the time and speaking to. I also talk to them about my background and my expertise, and I that the medical profession has not always treated the African American community with kindness, with fairness, and with respect. And I think when you initiate conversations, getting grounded in that sense, you are able to begin or breed, if you will, some level of trust with the community. Obviously, it's not going to be all encompassing if you are just engaging with the community for the first time, or if it's very early on in your relationship with that community. But then moving beyond that, what I also try to do is talk directly and specifically about some of the past historical injustices that the African American community has experienced with the medical and healthcare community. And I call out, those very situations that we often refer to, the Tuskegee experiments, the Henrietta Lacks situation. And I try to shed some light on those situations that helps break down the myths, if you will, and give more factual information. You often hear people say, oh, well, in Tuskegee, they gave us experimental medication. That's not true. And then I try to give the actual accounting of what really happened. And I think when you interact with community members and you're able to give them some sense of not just acknowledgement of their fears and the things that they are most concerned about, but I think that also helps them begin to at least open up a little bit to hear what it is you have to say and to possibly be open to what you are suggesting that they do. Now, finally, what I will say is those efforts will not always result in everyone, doing what it is you're actually trying to get them to do. But my personal opinion is if you can educate at least one person or a group of people and give them accurate, clear information, then you're one step further to being able to get them to heed some of those public health messages and public health actions that we want people to engage in.
Thank you so much, Dr. McKinney. You touched upon a lot of important points, and one of that is messaging. And I think messaging has been so key. And there's been some opportunities for messaging when it's been not done so well, and opportunities for us to get it right. And Dr. Arnold, I want to turn the floor over to you for this next question. A lot of discussion around the vaccine has been polarized with a lot of politics, unfortunately, right? We've heard both sides of the political paradigm talk about vaccine uptake, even COVID testing. And unfortunately, as public health professionals, we just want to talk about the science. We want to talk about the science, remain neutral, remain objective, and let the science speak for itself. How do we remove politics from a public health dialogue about the science of vaccines?
Well, I think, thank you for the question. And one of the things, I've come up with a quote of my own during this whole ordeal, and it's, remember, science never asks for you to believe in it, but it's incredibly unforgiving if you do not. So you can decide to step off the edge of a cliff and not believe in gravity all the way down, but you will get there just as fast. And if you survive, maybe you'll become a believer. But science, operates independent of the geopolitical, cultural systems that we're existing within. Science is unrelenting, and it is what it is. It is based on facts. It creates data as science moves along, and we try to get an impression of what that data is telling us. So once we start to mix politics with science, it can become a very deadly mixture. Throughout science, the scientific history, we've had people beheaded because they believe that the Earth circled the sun, instead of the other way around. One of the things that we have to do in the community is realize that the media is becoming more and more powerful as time goes on. I actually refer to it as the greatest uncontrolled experiment in human history. We have no idea of what this is doing to the brain chemistry of children and their interactions with these artificial experiences that don't occur in nature. And so as we're going along, what we have to do is we first of all have to have an educational system that tells the truth.
Mhm.
We have to have a system where people who are actually developing and learning understand what a vaccine is by the time they get out of high school, and why it's important to have one. So I see this as partly an educational system failure that has been unveiling itself. So it's very easy to fool people when they don't have enough knowledge or a knowledge base to think on their own independently. And so that's one of the failures of the educational system. But we also have to get things right. And Dr. Kenny was saying that things are exactly right when she was saying that, things like the Tuskegee experiment, it should really be called the Tuskegee study, because they actually did no intervention. They did not give people syphilis. That is a common misconception that's out there. And there was someone who was online that was like Monica Mayhem or something like that. It had 15,000 followers who were saying they were injected with syphilis, and look how they did these people. And they actually had a corroborating nurse who said, "Yeah, that was really terrible. I learned about that." And someone else saying, "That's why I'm not going to get vaccinated. That's why I'm not going to even get tested." And so we can set up a field of information that is disinformation, where it's actually destructive information, not just misinformation, but created to dissuade people from doing things that are in their best interest. And then we have things like in the background, Onesimus was a slave back in 1706, and Onesimus actually started with variolation, which was practiced in Africa for generations, going back 1,000 years, over 1,000 years, where they were actually inoculating people with smallpox, and they were inoculating people with snake venom, so the kids, once they were bitten by snakes, they wouldn't die. Actual science of this started in the Middle East. It started in Africa. So unless we understand the history of where science came from, where its origins were, the concept of zero, right? We have a miseducation on what science means to us in the community. And so Onesimus actually practiced this and gave it to a place person called Cotton Mather, who was his slave owner, and another doctor, who was in the community. They both got inducted into Royal Academy of Science in Europe, but he was never even mentioned. But because of what he did, it was right before the Boston Tea Party and right before the American Revolution. This country may not even be here were it not for him, giving them the idea of this technique. And then later on, of course, we refined the technique of doing vaccination. And right now, the science is very, very good, very accurate. We know what the components are, and we are getting a much better sense of what they do for us. What we do know right now is that it keeps us out of the hospital. It keeps out of an intensive care unit, off of a ventilator. So if you're fully vaccinated, even against all of the strains, the Delta variant, which is actually Delta variants, there's 17 different forms at least. Um, as long as we're protected against these things, these vaccines work. We know that they were done in a timely manner. They weren't rushed. They went through the clinical phase trials they should have gone through. We had enough representation from all of the communities, African American, Latino, and so forth. So at this point, what we have to do is get back to that disinformation and make people, hold people accountable. That's my personal feeling for what they're telling people to do. Because if I were to say to do a neurosurgery procedure as a doctor, even, I would be held to the standard of a neurosurgeon. If I don't have the license and I don't have the education to make a comment, probably I should not be making one to other people, where it can cause their death or cause them some really terrible outcomes and disability.
Dr. Arnold, as usual, you drop so much knowledge. I'm going back to some of the Monday sessions I've been able to listen in on you with where you're doing Congressman Davis and others. And every time I'm in your presence, you drop more knowledge. And I really like the fact that you reminded us to ground our analysis in history. And your reminder of what you reminded me of is that some of the narrative that we've heard is that, we haven't been a part, we meaning people of color, African American scientists even, have not been a part of this. And you really debunked that myth by talking about not only when we think about Dr. Kismet Corbett and physicians and researchers that are currently doing the work, you took us back in history to talk about this is actually something that we've been a part of since the beginning of time, with talking us through Onesimus and his work, and really kind of laying the foundation for what we know as modern day vaccines. So thank you so much for that.
Right, and Hoptep was the father of medicine, not Hippocrates. Let's start with truth.
and thank you so much for that. But you also touched upon something that really makes me think about. I'm so excited for Brianna and Kimberly to be on here today as future pharmacists, our future doctors, our future leaders, because I encourage people all the time to utilize your pharmacist. When you go, when you get a new medication, don't just start taking that medication without talking to there's a sign up there at the pharmacy that says, ask the pharmacist. And so Brianna and Kimberly, as you all know, you all are also, you represent our youth voice today at the table too. And when we think about that, the messaging, both Dr. McKinney and Dr. Arnold talked about trusted messengers to a sense, right? And so, without saying names, there's been a lot of celebrities who I'm not aware that they've gone through the training that Dr. Arnold has gone through as a physician, that they've gone through the training that Dr. McKinney has gone through as a public health professional, nor have they gone through the training that you all are going through. But they have offered their opinion and sometimes put information out that could be construed as misinformation about side effects that people have had from the vaccine, family members that they know of. And you all are right there at, boots on the ground. What has been some of your experience with this, the messengers that have got the message wrong, if you will? I'll start with you, Brianna.
Yes, thank you. I won't name names either, but I have seen some very dangerous comments made on social media. A lot of the younger generations, including myself, are always glued to our phones. So I think social media is definitely the best platform to reach us. And I know making the vaccine political has been a big thing. So a few years ago when things were shaky, a lot of us kind of put ourselves in those think tanks or bubbles when we were unfriending people who said things we didn't like. So nowadays when we see things about the vaccine, it's from people who, like Dr. Arnold was saying, don't have the qualifications to really speak on it. So I really do tell my friends and people that I talk to and people around my age to kind of diversify our social media, as people like the FDA and CDC and the World Health Organizations, even our local and county health departments have social media pages that give us factual information. And like Dr. McKinney said, just basing things on the science. So I think that's a big thing that we need to do.
Thank you. And Kimberly.
I agree with Brianna as well. I think about the patients we interact with, my family, friends, everybody, like when you want to go buy, I'll make it as simple as a car. When you want to go buy a car, you research that car. You want to go to the top dealer. You want the best car. You want it perfect, tip-top shape. You want to go to someone that you feel is qualified to make the best sale for you, to be the best advocate. I say that this, promoting the vaccine and everything is no different. I don't want to talk to you if you sell cars to tell me your opinion on vaccines. It's not to be rude or to be funny, but I want to talk to the people that's on the front line, that's helped creating it. I want to go to websites like Brianna said, the CDC. The CDC is like my go-to, as far as with updates, with changes, with everything. You hear so many things and you think about celebrities and how influential they are. I feel like if they would not only take the time to educate themselves, you could see a huge turnaround just by them promoting like the factual information. But I feel like, you see things on Facebook and TikTok and things like that. And you have some people that go on there and say, well, hey, this is not true because of XYZ. But you think about how many people come across all the misinformation. And then now you have only a few people trying to fight it with the truth. And I feel like this is one of those situations where people tend to believe the lies more than they believe the actual truth. And that's what we're fighting against.
Wow, that's so true. And I really want to go back to something that Brianna said, which is using social media for good and finding out that knowing that this generation is really, social media is a platform that's often used. Use it effectively, but use the social media platforms that are trusted. Like you said some of our public health professionals actually have social media platforms. Most of our hospitals and universities and institutions have have social media presence, and that's where we should be utilizing. I always like when we can give an asset approach, as opposed to a deficit. One of my mentors, Dr. Wayne, used to always say, talk about what we're packing and not what we're lacking when we talk about communities. And I really appreciate that knowledge you drop. I'm going to switch the conversation just ever so slightly to talking about, we know the importance of the vaccine, but those numbers I read out to you earlier would say that in Illinois, only about 54.3% of the population is vaccinated. So that means 1 in 2. So if you're in the grocery store and you're vaccinated, it's likely that other person is not. If we think about statistics for face value for what it's saying. So what is that message? And I'm going to pose this to each of you. And I'll start with you, Dr. McKinney, and then come to you, Dr. Arnold. What is that message we can give to people who are still not ready for whatever reason to get the vaccine?
Well, I think one of the things that's important in terms of a message to give, Dr. Arnold said it earlier, you may not want to get the vaccine, but the fact of the matter is the vaccine can prevent you from hospitalization. It can prevent you from serious illness to the level that it will prevent you from having to be on a ventilator or have some other type of long-standing consequences from COVID disease if you get it. The other thing that I would add, I saw an article in the New York Times just a couple of days ago where it talked about the fact that COVID will not be a crisis per se, it will be an era. In other words, what's keeping us in this right now is the fact that we have so much of the population that is not vaccinated. As long as the disease has the ability to continue to live, that means it has the opportunity to continue to mutate. And we will continue to be in this vicious cycle of disease. But moving beyond the vaccine itself, just because we have the vaccine doesn't mean that COVID is going to end when morbidity and mortality slow down and almost end. We will continue to have lingering psychological effects from teen as well as economic effects. And so the key message for me is helping people understand that the vaccination has greater implications than just our health and well-being, but also psychological and economic as well.
Thank you so much. And Dr. McKinney, you hit upon something. And Dr. Arnold, you said it earlier, but I want to elevate it out even a little more. You talked about earlier, I've heard people say, well, I've heard people that are vaccinated who have still gotten the COVID-19 virus. So why should I get vaccinated? Because that's what's holding some people. Some people are on the fence now because they're saying, well, even vaccinated people are getting the virus. But you pointed out some science that I want to elevate.
Okay. Yes, Dr. Watson. And Dr. McKinney was right, spot on with everything she said. And one of the things that what I'm worried about is this: when we start looking at what we put into our mouths, and both of you know Dr. Terry Mason very well about his quest for eating the right things and being a vegan, and so the arteries that we have in our body are really damaged by what we eat. So that leads to a lot of the things like the diabetes, the obesity, the heart disease, so heart attacks and strokes. And so this damage to our kidneys, this damage to our liver, our brain, is already going on. So we have a certain disease burden. But this virus actually attacks those same blood vessels. And what they're finding right now in the Mayo Clinic is that they're finding heart damage in people who are even asymptomatic when they got COVID-19. And so they're finding heart damage where the small blood vessels in the heart are being damaged. So you're getting cardiomyopathy, we call it, or pathology of the heart tissue. We're seeing kidney involvement. We're seeing an association with this with Alzheimer's disease. We're also seeing an association with Parkinson's disease as well. We're seeing strokes in kids that never would have them before. We're seeing scarring of lung tissue. We're seeing damage of the liver itself. So there are some grounds right now with the early preliminary data that's coming in showing that this may lead and exacerbate underlying chronic medical conditions or actually incite them, we got to have them to start where they were not before. There's one particular person that I ran across who's a triathlete. She's a major triathlete, loves the spikes, the swim, the run, and that kind of thing. So I was talking to her, and what she said, I said, "How are you doing?" She said, "Oh, we just ran across each other in a path." And she said, "I'm not doing that well." She said, "8 months ago, I had the chance to get vaccinated, and I turned it down because I'm a triathlete. You know, I eat well. I'm a I'm a vegetarian, and so I should not really need to have this vaccination." She said I was wrong. 2 months later, I was on a ventilator for 4 weeks. And when they took me off the ventilator, my lungs were so scarred. She said, "I'll be lucky if I get around this track once walking as a triathlete." So the implications, as Dr. McKinney was mentioning, and both of the other pharmacists, is that we don't know how this is going to affect people psychologically, even in the long term. So for those people who are, not getting vaccinated, the Delta variant has 1,000 times more particles than the Alpha variant. It spreads 50 to 60 times, percent faster than the Alpha variant, and it's that has devastation in our blood vessels. If you do have an antibody level, if you are fully immunized, the theory now is that you're able to take those particles out of your circulation faster, minimizing your risk for long-term chronic medical conditions, if that holds up with the data. So it is incredibly important for people to do that. And plus, the reason why I got vaccinated, I told people are fearful of getting vaccinated. So I got my first dose and I had a little bit of soreness in my left arm. And I took the Moderna and I went back for the second vaccination. When I got the second vaccination, I had a lot of pain in my right shoulder because I ran into a door running for a Zoom meeting. I actually got both vaccinations on the left and had almost no pain at all on this side. I had more pain from running into a door than getting vaccinated, right? So that should not be the thing that stops you. What I was fearful of is going on a ventilator rather than having a little bit of soreness in my arm, and that can financially bankrupt you. I was also afraid that I would walk across one other person in the community, as you were saying, Dr. Watson, 1 out of 2 people is not vaccinated. So I could walk up to a man or a lady out there, and even though I'm vaccinated, fully vaccinated, I still wear a mask. And the reason is I don't want to give that virus to someone else. I could give it to a man or a woman that I run across. They go in to see their child that has cancer in a hospital, and I give them the virus that they take to their kid that kills their child. It's not a me generation we should be living in right now. It's an us. So there's a community responsibility, a moral responsibility everyone has to protect the entire community, their families, their friends, their co-workers. And that is really where we should be sitting right now. But I think if we sort of push it a little bit further, people have to realize that they are of value to all of us. And so you have to do everything you can to protect yourself, to stay in the picture, and in the picture well, not with these underlying chronic medical conditions that we were talking about.
You touched upon some important things. I want to just take this brief moment before I hear from Brianna and Kimberly to invite our audience to please submit your questions to us at foundation@csu.edu. Again, that's foundation@csu.edu. We want to bring your voice to this conversation, and you have an opportunity to get some of your questions answered by some of the nation's experts here. So please submit your questions to foundation@csu.edu. So, Brianna and Kimberly, I want to bring the conversation back to you now. What have you all done in your social circles, in your professional circles, to be positive messengers about the vaccine and have conversations with those in your circles about why and how people should get protect themselves from the COVID-19 variant?
Yeah, I'll tackle. Oh.
No, go ahead,
Like
go
Dr.
ahead.
McKinney was saying, I think it's very important just to root yourself in your communities. I think it makes a world of difference. I think we can all speak on this. When you walk into a room as a person of color, representing someone in medicine. The way that people view medicine is probably based on the historical concept of people who are not Black, Latinx, and people of color. So I think that just being there and being that empathetic voice and, sharing the facts. And honestly, I can't stress it enough, the way that the person lights up when they see someone that looks like them that walks in the room. It's amazing. So just being there and being in the communities and spreading that knowledge.
That's why we need to one day be able to call you Dr. Hudson, because that's going to be so important, because people need to be able to see that if you can do it, that they can do it as well.
Absolutely.
And yes, just piggybacking off of Brianna as well, like, not only is that uplifting and encouraging, but it gives you, that motivation and that duty to spread the truth. One of the things, and it's even with something as light as I remember with my family, and I keep using them as a reference because slowly more and more of them are becoming vaccinated, just because I constantly, oh, hey, this is happening, do this. Oh, it's a pop-up. But I remember my niece was just like, they say that so many people, as soon as they get the vaccine, they're dying. And so one of the things, just even something as small as when I got my vaccine, I recorded it. I FaceTimed them and I said, and look, y'all, I'm absolutely fine. But it's just that every time they send something and say, oh, well, this happened, then they know, oh, Auntie Kim is coming. I'm coming with 5 or 6 different articles that says otherwise, but it's just emphasizing that, like, the truth is so important. And just being one of those people to be able to do that. And then, like you said, going back to your communities, I feel like us individually reaching people, they may not trust what the government is saying. They may not trust, what social media is saying, but they trust you. And you are that avenue and that open door to really, really just shed that light to, have everyone become vaccinated. So, and I say that as a mom, I think of all of this and I think about my children, as soon as the kids can be vaccinated, I can't wait, because that'll be a sense of relief for me with my kids, because I don't let them go too many places. When you bring back the statistics, 1 in 2 people are not vaccinated. I know my kids are not vaccinated. I'd rather you stay in the car and I'll run in and run back out. So I can't wait for them to have that protection as well. So.
Wow, you brought up so many important points, Kimberly. Thank you so much for that. And again, I want to remind our audience, foundation at csu.edu, if you have questions and you want to get those questions answered. And Kimberly, you brought up such an important point about youth and children. And Dr. Arnold, I want to put that question towards you. Parents are now asking questions, the same way. And you talked about the clinical trial phase. I don't think most people know that clinical trials have phases. Usually phase 1, 2, 3, and 4 that they go through. Whenever you want to develop a new drug, a device, and in some cases even a procedure, those things have to go through a rigorous cycle of research that is phase 1 through phase 4 for some development. And you talked about the fact that these vaccines that we now have available in the US have gone through those phases. And now we're hearing a lot about the research that's being concluded in children. Can you talk about what questions parents may want to ask their pediatricians or their providers before they get their children vaccinated?
Yeah, I think they have a special relationship with the pediatrician, or the provider that's going to vaccinate them. And then, we also have pharmacies now vaccinating as well. So pharmacists are, vaccinating. And I think it's really just answering the questions honestly. What can I expect once I get the vaccination done? What should I look out for if my child has some kind of sickness or illness? I think that's related to this. What should I do to make them feel better at home, right, after they've had the vaccination? But it's really incredibly important to remind them that we get vaccinations as soon as we're born. We get measles, mumps, rubella. We have tetanus, diphtheria, right? So we've got multiple vaccinations against polio. And I was in the military for 26 years. I had a chance to go to Uganda, and I saw a polio ward and what that looks like. And I tell you, we don't want to see that here. So those vaccinations that their kids have already received, as a matter of fact, the Delta variant on a scale of its ability to spread, it's about a 5. If you look at measles, it's about an 80. So measles spreads much faster than even the Delta variant. And we have kids still dying in the United States from measles when because people don't want to vaccinate their kids. So protecting your kid from a young age, especially when I was talking about the potential for starting chronic disease patterns early on with, damage to the heart, to the kidneys, to the brain, to the lungs. um, it's better for you to get your kid vaccinated early because you don't want them to, they have a long life to go. And, you want to make sure that you're doing everything you can to give them the healthiest path forward. Um, we don't know what's happening on the psychological side as far as the we always go to PTSD, but people have seen the deaths. Their children have also potentially seen the death of a grandparent from COVID, or a parent, or a friend. So we have to deal with that psychological side as well, and make sure that the kids are getting some counseling if they need it, because this is a hard time to go through. You don't have the time to grieve. We can't even have funerals, right, in the way we normally would. So I would say, look at what's happening with those kids that are being hospitalized right now. 99% of the people who are being hospitalized right now are not completely or fully vaccinated. So they're either unvaccinated or very partially vaccinated. And the partially vaccinated percentage of that is a very small percentage of the 99%. So most of the people who are on ventilators right now, who are hospitalized, chose not to be vaccinated. And so now we're seeing kids for the first time, in large numbers being hospitalized nationally across the country. So you don't want to see your kid in that position, and what that could do to you economically can be an economic damage to you, because those hospital bills, if you're not fully insured, can wreck your life. So taking the correct steps to protect your child, talking to your healthcare provider who's going to provide the immunization so you're fully informed, but knowing the potential bad consequences if you don't.
So, thank you so much, Dr. Arnold. Dr. McKinney, in our last few minutes, we have one audience member had a question. I know many of us in the public health space, we have to encourage each other, right? And the audience member said, I have several friends and colleagues who treat COVID-19 patients. They are burning out and losing enthusiasm for informing people about the safety and benefits of the vaccine. What is your rallying cry to fellow caregivers to keep fighting the good fight?
Thank you so much for that question. I think the first thing that's really important is just to be encouraging, be an encouragement to your friends and your colleagues who are burning out. Let them know that they're not alone. Um, Ask them how they are feeling. Sometimes it's enough to just be a listening ear, opportunity to decompress and get things off of their chest. And something else that I think we can all do, we saw it in the beginning of the pandemic when hospitalization rates were so high, and hospitals were near having the situation where they had to go on bypass, and we were all donating money and purchasing food and meals and other things to send to our friends and colleagues who were working in hospitals. And a lot of that has fallen off. And, for my colleagues that are in direct patient care, what I know is they really appreciated that. And it showed that there were others who were on the outside looking in who really care for them. So those are some of the things that I think we can all be doing. Be a listening ear, be a support system, check in with them, and just give them the opportunity to share with you how they're feeling. Again, a lot of times it's just the ability to decompress a little bit that gives them the energy to go just another hour, just another day, just another week. But, I think the point of that is they are showing their care and compassion for the human race by choosing to work in a field where they are caring for people who are sick. So let's show our care and compassion for humanity by just checking on them and helping them and doing something nice for them.
Yeah, that's so important. That there's a saying that says check on your strong friends, right? And so, Dr.
Exactly.
Arnold, the last question we'll pose before we have closing remarks, just briefly from each of you, is that an audience member says, what should I do if I didn't get the second shot of a 2-dose COVID-19 vaccine?
Drop the mic and go in today. Get your second shot right away. Hey, I like that. That's kind of rhymed a little bit, but but the thing is that they used to say with a hepatitis B vaccine, for example, if you missed a dose for a certain amount of time, you may have to restart the series. What they're finding right now is just go and get your second dose. Complete your second dose and then start getting your mind ready for that third dose. That the booster dose they're calling it. So I think just get back on track. Don't feel bad that you didn't do it, but know that with the second dose you dramatically boost your immunity from the first dose. So it's really important to get that second dose to complete your series, and then think about that third dose.
All right, thank
And
you
as
for
Dr.
that.
McKinney was speaking, one of the things, she was really very articulate about what she was saying. Very good, well said. And I was thinking, one of the things is that we had so many people who survived from COVID-19 right now. They need to call those doctors and those nurses and those healthcare workers back and say, thank you for saving my life. And, thank you for putting that time into, and that would really, I think, increase their morale to a great degree too, because when you're in the pit like that, you only see failures. You don't see the successes you're sending out the door. So they need to know that they're making a big difference in the world.
That's a great point. Thank you goes a long way.
Yeah.
And speaking of thank you, I want to thank each of you. You all have been amazing. And I hope that our listeners, for those who are watching this live or who go back in and watch it later, really understand that you all truly represent the voice of the community. You from being a servant leaders, and I want to thank you. And before we go, we talked about encouraging ourselves and encouraging our colleagues. And Kimberly and Brianna, you both are full-time students. You're in it right now. And Kimberly, you even spoke to it a little bit about being a mom right now. How do you stay motivated, Kimberly? And what message of motivation can you give to our audience?
Without getting churchy, my kids are my biggest motivator. My friends, my family, there are long days. But like you said, a thank you, you can do it. I'm praying for you to just keep, we have to stay, tunnel vision, just like with school with this thing, to see it to the end, to see that change. But my kids, every day, just seeing them and knowing that they are the future, let me just keep fighting the good fight so that I can live to see them fight the fight as well. So they're my biggest motivation.
All right. And Brianna, what about you?
Very similar thoughts, just remaining optimistic, continuing to uplift each other. Definitely those thank yous went a long way at the beginning of the pandemic, and they still do now. Just encouraging people to get vaccinated, being out there in the community, wear your mask, wash your hands, and knowing that there is a light at the end of the tunnel.
Well, thank you all so much, and remind us to wash our hands. Public health practice still works, you all. Public health still works, and we want to make sure that it still works. And want to thank you all, thank our hosts, and thank our organizers of the event. And I want to remind you, if you are part of that community that is still on the fence, but you want to know where and when can you get the vaccine, and not only are we thinking about the COVID-19 vaccine, but also we're getting ready to prevent flu season as well, you can join the group tomorrow on October 16th from 1 p.m. to 3 p.m. for a community vaccine event at the Bronzeville Children's Museum. Get the vaccine and receive a potential gift card. It's going to be, again, this is a Vaccinated event in collaboration with Blue Cross Blue Shield of Illinois, and they'll offer the COVID-19 vaccine and the flu shot. Free lunch as well, and they'll be available for some pop-up plant and flower sale. You all don't want to miss this event. Tell a neighbor, tell a family, tell a friend. Go out, attend the event, get your vaccine, and continue to be safe. Thank you all so much, and have a blessed and amazing rest of day and rest of weekend.
Thank you, Dr. Watson.
Thank you.
Thank you, everyone.